After tenotomy, the cast is maintained for 3 weeks. At the end of 3 weeks, the cast is removed and the foot is fitted into a brace as soon as possible. Any cast change is not encouraged to be done at home. It has to be done in the setting where the cast is reapplied or changed onto a brace. That's important because the child should not have the feel of the freedom of the free foot. Then the adherence, we don't like the word compliance, the adherence of protocol for bracing gets compromised. So as soon as the cast is removed, the child is measured for a foot abduction brace. The one that we use is called a Steenbeek brace, designed as a cost-saving scientific method based on Ponsonby's methodology of foot abduction. Mikkel Steenbeek, a Dutch physiotherapist, designed it to be used for children in the Uganda Clubfoot program. We use the Steenbeek brace. The principle is quite unlike that of a Dennis Brown splint. Many people call this the Dennis Brown splint. However, remember, principally it's different. Dennis Brown splint is based not on abduction. The external rotation of the foot component of the brace in Dennis Brown splint is only about 15 degrees. However, you can increase it to bring it to 70 degrees or 60 degrees as appropriate in a given child. So these braces are in different sizes, 4 to 24, to accommodate different children's foot sizes. The components are 2 feet of the shoe, the bar connecting it. New one will have a straight bar. Once it is fitted for a child, it is molded like that from there by bending by the counselors who are trained in fitting it, and then taken to reduce or increase the abduction. So if the normal side is this, the abduction is reduced, and the affected side, the abduction is 60 to 70 degrees, and on the normal side, the abduction is 40 degrees. So the abduction and adduction can be controlled, and some degree of dorsiflexion is controlled by maneuvering this. And you give the brace. Remember, the brace has a heel hole to inspect whether the heel is resting comfortably on the insole of the brace. The mother can look at it, the counselor can look at it, the doctor can look at whether the heel is placed correctly. This counter of the shoe should not be very high. If it is very high, the child will use the upper end as a fulcrum and kick out his heel from the shoe. We don't want that. If he kicks his heel out, equinus will recur. So, the bilateral foot, the foot abduction brace, each will have a 70-degree abduction. The bar will separate the feet. The width of the bar is from point to point shoulder measurement for the child's shoulder. So that is the width of the bar, and the unilateral child will have the abduction reduced to 40 degrees. The protocol for brace wearing is fit the more difficult foot first and then the easier foot. Fit the child as soon as possible after the cast is removed. The child must wear the brace 23 hours out of the 24 hours. Why give a break of 1 hour? Only for ablutions, washing, donning and doffing of clothes, etc. The child must recognize the brace is important for the child, and therefore do not allow the child free from the brace. 23 hours a day he has to wear it for the first 3 months. After that, it is night time and nap time. Why night time and nap time? Because these kids are very intelligent. They recognize that when they are sleeping in the daytime, the mothers do not put the braces, but they are sleeping at night, the mothers force them into the braces. They'll howl their way out of the brace at night also. So they learn to manipulate the parents. So it's important that the child must recognize the association of sleep with the brace. So nighttime and nap time brace. Rest of the time, normal footwear. Or if culturally the child walks barefoot in the village, let him walk barefoot, that's not an issue. But nothing in between times. Nighttime and nap time after 3 months. Follow up every 3 months, each time score the child. Continue the brace till the child is at least 3 years, preferably 5 years. Maintenance phase is 5 years.